Welcome back.
Thank you.
Nice to see you.
Nice seeing you too.
How you been?
No complaints. Just got back from Machu Picchu and here for my 6-month follow-up.
Yeah, we did some hair metrics on you, collected some data. Your numbers are up to the roof in every location. I know when you were here 6 months ago, we were addressing the frontal hairline.
Yep.
But have you noticed that the crown's also got a little bit better?
Absolutely. I mean, the front's gotten substantially better, and then the crown, I've also seen improvements in that area as well. So
it's nice that you saw improvement in the crown, because not an area we actually grafted, so you're a good responder to the topical finasteride we put you on. And you've been on it. Did you start that prior to the operation or afterwards?
Probably, I think it was maybe roughly 2 weeks afterwards. So let things kind of heal up, and then got it filled, and then started applying it. Yeah, I would say probably 2 weeks or so after the surgery.
And it's been daily. You've been pretty consistent with it.
Yeah.
Good.
Just, I don't know, put it as part of your morning routine and knock it out, and then move on.
Well, the results are definitely showing, so I can tell you've been consistent.
Thank you.
But I wanted to kind of get an understanding about how you got right to this point. So,
sure.
You were started thin out. When did your hair loss begin?
I mean, I don't have the best family genetics, but for me, I probably noticed it late or mid-20s, late 20s, and then as I got older, just something that became more aware, and then you would look in the mirror, and even if it may not have been a huge issue to other people, then that would be just an area I would focus on. So I'm probably 5 to 7 years before I ended up getting the procedure.
And did you notice you changing your hairstyle to kind of conceal things, or were you wearing a baseball cap more often?
Not necessarily a huge baseball cap, but there's definitely the swoop over, or trying to give as much coverage as possible with what you were working with. So you had to be a little not innovative, but the barber, you would ask them to be let's keep it long on top, and give it some room to do a swoop.
So it's something you were dealing for years. Yep. And then what made you want to do something about it?
I mean, I was poking around doing research, been reading about it, thinking about it for a while, and then I had a friend who talked about the process with Dr. Cole and their results, and then when you were able to see them firsthand, and the before and after pictures that my friend showed me, kind of sealed the deal.
Awesome. Yeah. Well, you're kind of living proof of that, right? So, we were just going over your photos recently. Showed you the before, the after, and
yep.
Well, one of the first things you mentioned, I didn't even realize it was that bad.
Yeah. I don't know what that says, but now when you look in the mirror, this is what you got used to very quickly. But the before picture was definitely. We can delete that.
Awesome. How's your everyday life now? I mean, are you spending less time thinking about your hair? How has it impacted you?
So there was about a week and a half where I worked remotely after the procedure. The recovery process was very straightforward. The directions you guys gave me were thorough and addressed anything that, nothing came up, but anything that, if it did, the instructions went through the process on how to handle it. But yeah, just not as self-conscious, looking in the mirror, or just, I think a confidence boost is the main thing, where it isn't something that you're thinking about or putting energy on, which, that energy goes to more productive things now.
Yeah. Oh, I know you were mentioning that you were looking at donor areas immediately post-op, and you had some major concerns about like a moth-eaten donor area. You know, you've seen when the moth does the cashmere.
Oh, yeah.
How do you feel about your donor area recovery?
Yeah, I mean, it looked honestly like I got a buzz cut, and then once it's like started growing out, like you could not tell that was the donor area at all. There's no scarring. It like honestly, the whole recovery process and whether the donor area was seamless, and yeah, I'm not sure what Dr. Cole did, but that was not an issue, and nothing but like positive things about that part.
So, looking at it now, if you could go back in time, what do you think you'd tell your previous self?
Do it sooner. Where I think it's easy to get in your head and just be like, oh, I'll do it. But, seeing the picture, like the before, the after pictures, and like where we're at just 6 months, like post-procedure, it's been amazing. And, there's still a few more months of like growth to come. So only onwards and upwards.
Yeah. And is there anything you'd like to share about Dr. Cole or the staff?
I mean, it's been, the whole process was very much at like your own pace, tempo, where I had a consultation with you, then I actually think I had a follow-up one with Dr. Cole in person to answer any like questions I had, where it's just sometimes it's nice to hear it from from Dr. Cole himself, but throughout the whole process with like the day of the procedure, folks were very, like super responsive. And if there's ever been, there's been follow-up emails and telephone calls after the procedure, seeing how things are going, where you would think that you would be the patient would be the one initiating those contacts, but that hasn't been the case. If anything, it's been, yep, I'm doing well. But I appreciate that it was all done at my speed, like, nothing felt rushed, and it was, everything was tailored to what I was looking for, as opposed to, I didn't feel like there was a set agenda, which is beneficial when you're doing something like this.
How do you feel about, as far as your quality of life after the operation?
Good.
Yeah, I got more hair. Right?
Yeah.
I look in the mirror. I'm sure you think typically having more hair makes you feel a little bit young. It makes you look a little bit younger.
Yeah, no. There's nothing been like life-changing. It's more like just, you're not spending energy on something. You're not spending energy focusing on something, on that aspect anymore. And so, that energy goes up like to much more productive things.
Well, there's a lot of things you can do. Like, you get fat, you can go to the gym, you can work out. You start losing your hair, you kind of learn a whole lot of options, right?
Touche.
Yeah. But I'm glad we got you. It definitely looks impressive. I'm really happy with the way your result turned out. And glad it's coming along, and there's more growth to come.
Yeah, no, I'm excited.
Yeah, well, Nick, I appreciate you coming in for this, and we'll see how it looks in the next 6 months.
Sounds good.
Thank you, Mike.
Forehair is run by Dr. Cole with 30 years of FUE hair restoration experience, and we offer the most cutting-edge technology available. In fact, the Forehair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forehair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forehair's video uploads. For online consultation, click on the link on the screen or in the video description.